Hello, today we are discussing about leukonychia. Leukonychia refers to the presence of white discoloration or on the nails. It is a common nail condition that can appear as a white spot, lines, or even complete whitening of the nail plate. Types of leukonychia. One is the Leukonychia punctata, small white spots on the nails, and usually from minor trauma or nail biting. Most common type is Leukonychia punctata. Leukonychia striata is the other one. It's also called as mees lines. White horizontal line across the nails may be linked to systemic illness and arsenic poisoning or chemotherapy. Leukonychia totalis, complete whitening of the nails, and can be hereditary or related to systemic conditions. Leukonychia partialis, a partial whitening of the one or more nails. Major causes are minor trauma to the nail matrix, which is the most common cause, and the nutritional deficiencies like zinc, calcium, and protein. Systemic illness may be affected with the liver, kidney diseases, heavy metal poisoning, majorly arsenic. Fungal infections, genetic factors, symptoms like white spots, lines, or patches on nails, usually painless and harmless in minor cases. Many indicate underlying health issues if the widespread or the condition is persisting. Medicines. Calcarea car for the white spots or lines on the nails, useful in individuals who are chilly, overweight, and sweat easily. Nails may be brittle or weak. Silicea helps in slow growing, weak, brittle nails with white spots. Good for people who are prone to infections and slow in healing. Calimere or potassium muriaticum. For white patches or spots on nails, nails may be thickened or show layers of peeling off, often used for nail and skin complaints. Graphitis for white discoloration along with the cracking and roughness of nails. Help in skin and nail disorders with scaling. Phosphorus for nails showing white spots or lines with a brittle texture. Useful if accompanied by bleeding, gums, or anemia. Natrum or sodium muriaticum for leukonychia with the white spots, also helpful when associated with the emotional stress or dehydration. Arsenicum album for white discoloration with burning sensations and restlessness, helpful if there is a history of toxic exposure or weakness. Natrum phosphoricum, useful for white spots or lines on the nails. Helps with a condition involving acidity and skin or nail changes. Good for people with the digestive complaints alongside nail issues also. Calcarea force for the white spots on nails with slow growing and weakness, often indicated in children or growing individuals, supports bone and nail development. Thuja occidentalis for white spots, peeling or deformities of nails, helpful in if leukonychia is associated with warts or previous vaccination effects. Lacanine for white spots or patches on nails, useful if leukonychia follows the milk intolerance or digestive upset. Phosphoric acid for the white discoloration with a general weakness or after prolonged illness, helpful in cases with emotional exhaustion. Other condition today we are discussing about is mees line. Mees lines are transverse white bands or lines that run parallel to the lunula, horizontal across the nail, and usually involves all nails symmetrically. Key features: they are white, non-balancing lines, don't disappear when pressing the nail. Usually occurs in the fingernails and toenails. The lines grow out with the nail over time. Indicate a temporary interruption in nail matrix growth. Causes of mees lines: heavy metal poisoning, especially arsenic and thallium. chemotherapy or radiation therapy, severe systemic illness such as kidney failure, heart attack, and infections, trauma to nail matrix, carbon monoxide poisoning, symptoms such as white transverse bands across the nail, no pain or discomfort directly from the illness may be associated with the symptoms of the underlying illness or poisoning. Medicines which are indicated Lycopodium clavatum, helpful when mees lines appear in the people with digestive disturbances, liver issues or low vitality. Often used when there is a bloating, gas and weakness. Supports liver functions and improve the nail quality. Carcinosinum for the chronic deep-seated systemic disorders, useful if mees lines appear after long illness or chemotherapy. Helps with the tissue regeneration and immune system support. HEPA sulfcalcarium indicated when nails are brittle, cracked or have white discolorations. Helpful in infections or when there is a sensitivity and inflammation. Beta-carb useful for slow growth of nails and white bands, especially in elderly or debilitated persons, helps with the overall weakness and tissue degeneration. Natrum sulf for toxic conditions affecting the nails and helps in detoxification and repairing the nail matrix and disturbances. Additional care tips are medical evaluation. Mees lines often indicate a serious underlying condition. So it's important to identify and treat the root cause, as I told you about the arsenic and thallium poisoning. So first we have to think about the major poisoning only if you are seeing a mees lines in a patient. And nutrition, support with the diet rich in antioxidants, vitamins, especially A, C, E and B complex, and minerals like zinc and iron. Avoid toxins, limit exposure to heavy metals, chemicals and unnecessary medications. Hydration and nail care. Keep the nails moisturized and avoid trauma.